inches above, and that's going to bring me to the top of the ear. I want small pinpoint but scaling techniques as I'm working my way through the hair so it doesn't irritate my elbow. And depending on your direction, face to face is going to be one direction, we have face to sides, and then we have face to feet. But I want to keep my movement a little bit smaller, and as I change my direction completely, I want you to rearrange the hair in that direction a little bit. So you're always kind of going with the grain. So after I've done that, I'm going to scale my way over to one side. After I kind of head towards that temporal bone section and I'm coming just off the occipital bone, I'm going to lift her head and she's going to face towards me. And we're just going to place her head down like so, because now I can access all around that temporal bone really well. This area is going to be amazing for people who have like progressive hearing loss and tinnitus. This is like the focus point. But if I'm working with somebody who has like tinnitus or progressive hearing loss, we're going to get them on the floor as well, and I'm going to work all around to their TMJ. And then afterwards, I want them doing like the soaks. So like the ear clear, the fulvic nano eye drops, the silver bullet solution, and doing like rotations around with that. And then if they're at the clinic, like our clinic, I would put like the energy medicine device around it, maybe sonic the back of it to help open it up even more. And then we would just kind of see how that goes along. So I'm going to, after I started working out from the back of that occiput, I was scaling from the ledge to about 2.5 inches above, just from like the bottom of the earlobe, top of the ear. That was my gauge. Once I stopped from where I was comfortable, I lifted her head up and I tilted it. I'm going to stay on that side, and I'm going to work all along till I get to behind her ear. And I'm going to work all the way to the back side of that ear, and I'm going to fold it over just to make sure I can get to all the way to the ledge of that temporal bone itself. And then after I've done that from one direction, I'm going to flip myself around, face the other direction. And you're going to pull everything down and back out. And so then I've played all 4 directions on one section. So then I'm going to pull down and back in towards her occiput. We're going to shift her head back to the middle. As I scale along this occipital bone, taking my time, constantly readjusting that hair, because remember, there's not a lot of oil. I want small pinpoint movements. As I work my way over past this occipital condyle on this side, I'm going to lift her head up. We're going to tilt, and we're going to focus on this temporal bone now. And then I'm going to go face to face, face to side, working all the way to the back side of the ear, focusing all around the temporal bone to the ledge of that occipital bone. I've done that from face to face and face to side. I'm going to flip back around, and I'm going to pull face to feet and face to side, pulling everything up and back in towards the middle. And I'm just going to center her head, finishing directly into the middle, kind of where I began at that C1 base of the occiput. Then I'm going to finish with a nice airplane landing effleurage massage. I usually will put essential oils, and peppermint's a really great one for this because it's a good stimulant. So people who feel like a little, because at the end of these treatments, it's areas that aren't commonly worked. So getting it worked thoroughly, people call it, because you're releasing so many endorphins during a session like this, that like afterwards it's a little massage drug, so it just kind of like helps stimulate them and get them back to like balance. So I would take a couple drops of like peppermint, and I would just put it on my fingertips, and I would just weasel it through their hair to get to their scalp, and then I would just finish with a nice scalp scrub. It's not so much of like an airplane landing because it's the scalp, so just finish with like a nice scalp scrub. And that would be the occiput. Sounds good?
Yeah.
Okay, I'm going to begin the demo now then, everybody. So starting directly in the middle, going to touch on C1 and those occipital condyles. When I have clients come in, I normally 95% of the time know what I'm going to be working when they come in, unless it's like a completely new client, but then I'll do like a case history form with them. I'll try to plan like my harder stuff, so like my ankles, my feet, my knees, my occiputs for the end of the day, because they normally wear on the elbow. So I don't want to like a long day after I do like 1 or 2 occiputs. So I worked right on C1, small pinpoint movements. Worked one occipital condyle. Coming across the ledge. Working the other occipital condyle. Playing as much windshield wiper as I can. And now I'm scaling from the base of that occiput, so right off the ledge, and I'm going to work all the way up to 2 inches above. So now I know I'm around the top of her ear, and I'm just going to keep playing my windshield wiper